I chose to learn more about adventure therapy because it just sounded exciting and challenging and fun. Um, the idea of adventure therapy is really to combine therapeutic group work, educational curriculum uh, in the setting of nature. And that makes sense because as long as people have been around, they have sought mental, physical, and spiritual growth in the great outdoors. Uh, so it's no surprise that now we see a modality where therapists are bringing groups of children into the woods to do really important therapeutic work for a number of presenting concerns. Um, we see people going to wilderness therapy for substance abuse challenges, emotional disorders, um, uh, really pro-social development, and a broad range of other presentations and needs. Uh, so what is wilderness therapy like? Well, for one, you're in nature. You could be a 30-minute drive from your house, or you could be halfway across the country and out west somewhere. Uh, and the duration could be a few days, or it could be a year. And there's many options in between. Depends really what you're going for uh, and what your needs are. And while you're out in nature, um, not only are you experiencing just this ineffable peacefulness that is, being in the wild, but you're also away from some of the unhealthy environmental factors back home. So if you're using drugs, you're at home and you have a problem with that. When you're in the woods, you don't have access to your friends that might be using, or your stash, whatever it is. If there's a toxic environment at home or with friend groups, you're removed from them for a time, and it's a place for you to work on some personal things without the influence of some unhealthy environmental factors at home. Okay, uh, so sort of, there's all kinds of activities that you can do out in the wild. There's the conventional activities like kayaking, hiking, camping. Uh, but sometimes in therapy, group leaders will implement certain challenges, and they might also feign this sense of danger. There isn't actually much danger, or any danger for that matter, but maybe the therapist will let on that this task is a little bit more desperate than the participants might otherwise think. In any sense, for some of these children who might not be experienced um, backpackers, yeah, this could be a big deal for them. So a challenge might include an orienteering exercise where a limited group of maybe 3 clients are given a map, a compass, a walkie-talkie for emergencies, a small ration of food, and just a few items, some rope, maybe a tarp. And the idea is that they need to find a place suitable for shelter, given some parameters, and work together to make this happen. So how is that therapeutic exactly? Uh, well, what's happening is teamwork. Um, these clients are assuming personal responsibility. They're confronting stressful situations, and they're planning. They're problem solving. Um, and the students, they might not know. I call them students, clients. They might not know that's the point. The clinicians might not tell them, oh, we're really assessing not your ability to create a great shelter, or to find the exact or the best location for where to set up camp. We're really going to be looking at how you all do this together, how you interact, how you operate as a team. You might look at other factors. Who assumed the leadership position? Did different individuals assume different roles? And later on, as they process their experiences, we can provide discourse, build insight on that experience. So really, amazing stuff. The professional personnel would require, of course, a licensed therapist, but we need people that can work their way through the woods, that are physically fit, that can make quick decisions when it comes to outdoor planning or outdoor situations. It might be important that somebody on the staff knows first aid. Maybe a nurse can tag along. I certainly would recommend that. So there's definitely some limitations as to what sort of provider can do this sort of work. So research has shown that this type of modality is at least as efficacious as traditional, residential programs and whatnot. And this is based on self-reporting questionnaires, both by the participant clients and their parents. So we've seen beneficial outcome. Of course, there will be some limitations due to the self-reporting nature of that data. But we have seen in some situations, a higher rate of success than in more conventional settings. But there are some ethical considerations to consider, and the most glaring one is the cost. Wilderness therapy is immensely costly. It's more costly than residential treatment programs. It's more costly than conventional treatment in your hometown. For obvious reasons, there's travel involved. But interestingly enough, adventure therapy is less costly than if one of the clients were to be put into the justice system and in a juvenile detention facility. If a year in juvenile detention facility costs more than a therapeutic adventure program for a number of months. Safety is a big concern. There's a lot of dangers to exposure, dehydration, malnutrition, hypothermia, becoming lost, fatal accidents, bone breakages, all that sort of stuff. It's all possible when you're out in the woods. Anything is possible. You really need to be careful that your staff is trained to recognize symptoms of these various health hazards, especially dehydration, hypothermia, etc. With minors in their care, failure to recognize potentially fatal symptoms can be disastrous. So that is an ethical concern to keep in mind. Overall, humans have this inextricable connection to nature. And being in the wilderness is a humbling, gives one a humbling sense of connectivity and perspective about themselves and their place in the greater scheme of things. And bringing a person, throwing them out of their lifestyle and bringing them back to the basics can certainly, and the research shows this, facilitate physical wellness, a sense of purpose, and greater meaning in life. I would be interested to see ways that the government can fund similar such programs for children who are at risk. Perhaps they're at risk for in and out of the juvenile detention system, and otherwise for those for those clients who are more fortunate and they are living in more affluent families, luckily, they're how do I say this? I I don't want this to come off the wrong way, but they're lucky enough to have access to this type of services, and I think it's a great outlet for anyone who has the opportunity to go. You know, there's a lot of wilderness to go around, and if we put our heads together, I think we can see everybody having a chance to escape the clinics and the conventional healthcare system and find their way out into the wild. And that is it. Thanks for listening.